Okay, so this poster is titled The Next Day Effects of Cannabis Use, a Systematic Review, and it was authored by researchers from the Lambert Initiative for Cannabinoid Therapeutics within the University of Sydney. So the background to this poster is as follows. Firstly, we know that delta-9 THC, the main intoxicating component of cannabis, can impair cognitive function and performance on safety-sensitive tasks. Less clear, perhaps, is whether this impairment is still present many hours or even days after THC use. This, of course, could have important implications for individuals employed in safety-sensitive positions and for drivers and things like that. So we conducted a systematic review of studies investigating the next day effects of THC on cognitive function and safety-sensitive tasks. Studies were included in our review if they measured performance on safety-sensitive tasks and or discrete neuropsychological tests more than 8 hours after THC or cannabis use using an interventional design. Risk of bias was evaluated using the relevant Cochrane tools, and results were described in terms of whether THC had a statistically significant effect on performance relative to the primary comparator, so placebo or baseline as applicable. 20 studies were ultimately included in this review, and these studies administered a total of 345 performance tests across all treatments and time points more than 8 hours post-treatment. The characteristics of the included studies are summarized in Table 1. What you can see is that most studies used either randomized or non-randomized double-blind placebo-controlled designs. That other or mostly occasional cannabis users were studied more often than regular cannabis users. THC was typically administered via smoking, and the doses generally ranged between about 10 and 25 milligrams. The results of the risk of bias assessment are presented in Figure 2. We also have summarized various different standardization procedures employed in Table 2. So that is the methods used to control participants pre-trial and within trial, sleep behavior, as well as cannabis, alcohol, caffeine, and other drug use. The overall findings of the review are summarized in Table 3 here. So firstly, what we found was that 209 performance tests conducted across 16 studies showed no next day effects of THC. Most of these 16 studies did use randomized double-blind placebo-controlled designs. Half had some concerns and half a high risk of bias. Of those with some concerns, 3 did employ robust standardization procedures. In contrast, we found only 12 performance tests conducted across 5 studies indicated negative or impairing next day effects of THC. None of these 5 studies used randomized double-blind placebo-controlled designs, and all were published more than 18 years ago. 3 had some concerns and 2 are high risk of bias. Of those with some concerns, none employed robust standardization procedures. In conclusion, it would appear some lower quality studies have reported next day effects of THC on cognitive function and safety sensitive tasks. However, most studies, including some of higher quality, have found no such effect. Overall, it appears there is limited scientific evidence to support the assertion that cannabis use impairs next day performance. Thank you.